Hi, this is the third video on low back pain. The physical examination will start the minute the physician enters the exam room. The physician will want to see if the patient is standing and how the patient moves to the examination table. A standing patient can be standing because of pain on sitting. The physician will want to know if the patient had difficulty removing his or her shoes and changing into the exam gown. Next, the physician will inspect the spine, noting its contour, symmetry, and any deviations from normal. The buttocks and legs will also be inspected for contour, symmetry, and deviations. The physician will ask the patient to lie face down on the examination table in order to allow the physician to palpate the spine and adjacent tissue. If the patient cannot lie down on the table, the physician can examine the spine while the patient is standing or sitting. The physician will identify the L4 and L5, that's lumbar 4 and lumbar 5 vertebrae levels, as reference for further examination of all lumbar vertebrae. The physician will apply pressure to the spinous processes and to each side of the vertebrae in order to reproduce the patient's pain and to note any anatomical abnormalities. The physician may also do additional tests to provoke a pain response from the patient. The object of the test is not simply to continue to produce pain, but to aid in diagnosis. One test is called the slump test. It is a good test to use on those with back pain radiating to the lower extremities. The patient is asked to sit on the edge of the table, with legs from the knees dangling off the table. The patient is then asked to slump forward, placing the chin on the chest. The leg that does not have pain is then straightened. Then both legs are straightened. The foot of the leg with pain is pushed backward and up. The test is considered positive if pain in the leg or back are reproduced. It indicates a possible disc problem. The physician will also proceed with a neurological examination in order to ascertain that there is no compression of the spinal nerves due to a disc problem or tumor. The physician will want to ascertain if the nerves from L1 to L5 and S1 have been compromised. The patient will be asked to walk on their heels and toes. The physician will use a reflex hammer while the patient is seated on the exam table to check reflexes associated with L4, L5, and S1. A straight leg raising test will also be done. The patient lies on his or her back on the table. Each leg will be tested. The test stretches the sciatic nerve that runs down the back of your leg and the nerve roots that lead to it. If you have pain down the back of your leg below the knee, when your affected leg is raised, the test is positive. It means that one or more of the nerve roots leading to your sciatic nerve may be compressed or irritated. If doing this test on the unaffected leg causes pain in the affected leg, it helps to confirm that one of those nerve roots is compressed or irritated. It indicates a disc problem. The physician may also test your feet to see if you show any resistance to eversion or inversion. Eversion is the movement of the sole of the foot away from the center line of the body. Inversion is the movement of the sole of the foot towards the center of the body. Some physicians will do more in their exam, but what we have discussed is appropriate for an exam. We'll continue our discussion of low back pain on the next video. I hope this helps. Have a good day.